Hey there and welcome to my channel. Today's video is just going to be another pregnancy update, my 35-week update. Hopefully this isn't all over the place because I don't have my notes, so we're just going to wing it and hopefully this isn't too rambly and not all over the place. So if you hear something in the background, Isaac, my son, is laying over here beside me. He does not want to go to bed. So I want to get this done, so we're just gonna have to, hopefully he won't be too distracting and he'll just lay right there. His tongue is red because he has Hawaiian punch in his cup, sugar-free, but it stains his mouth. Okay, so yeah, anyways, he'll be sitting over here. Like I said, hopefully he will be content for a few minutes so I can finish this video. So just starting off with weight gain, I've only gained about half a pound, so I'm like 160.5 or something like that. At least that's what I was at my doctor's appointment on Tuesday. Today is Thursday, so I'm 35 weeks and 1 day. Yeah, so I've only gained half a pound since my last doctor's appointment. As far as symptoms go, I have been very tired this past week. I've just been feeling very worn down. Still have the lower back and hip pain. I'm not sleeping good at night. Between tossing and turning all night long, getting up to pee 50 million times a night, just like the usual stuff that I've been dealing with. I've also started getting, like, I think I mentioned before, pregnancy insomnia, but I'm still having that, and it's like, it's really weird. I go to bed, it doesn't even matter what time I go to bed at night. I wake up every night around 3:30 in the morning, and it's usually because I had to pee, but then I'm wide awake for about an hour, and it's like usually not until 4:30, 5 o'clock until I'm able to fall asleep again, and then I still wake up early in the morning. So it's kind of irritating. I guess maybe my body is just trying to get myself ready for waking in the middle of the night with a newborn. I don't know. I remember something similar happening with Isaac. I can't remember exactly. I think with Isaac I was like only sleeping in like a couple hour intervals, but this time I'm like just waking up in the middle of the night and then I'm wide awake and then it takes me forever to fall back asleep. So I've been dealing with that. That's gotten like very common this past week. I've been having really bad heartburn and like reflux, which is something I've been dealing with this whole pregnancy, but I feel like it's like as time goes on, it just keeps getting worse and worse. Like it's just more frequent. Like all day long I have heartburn. And I've still been having really bad gallbladder issues. I've been pretty much having a gallbladder attack almost weekly. It's very frustrating. It's very painful. I actually broke down, what was it? Monday I had a gallbladder attack. And it's like to the point now where it doesn't matter what I eat, what I do. I've been trying to eat very healthy, following a gallbladder diet, and it's like it doesn't matter what I eat, how little I eat, because I've been trying to do like the 6 small meals a day or just like snacking throughout the day and not like filling up all at one time. So as I was saying, I can't remember where I left off. Isaac was interrupting me. But yeah, Monday I had a gallbladder attack, and as I was saying, it's like it seems like it doesn't matter what I do to try to prevent it. They keep happening. They're happening more frequently, and it's just very painful. And so I've been very emotional this week. So that is one symptom that I've been having. I have been getting very emotional. I guess just like, first of all, pregnancy hormones. 3rd trimester, I remember with Isaac I had gotten emotional, but I'm feeling more emotional this time around just because we are getting close. For those of you who don't know, or if you don't know about how we lost the last baby, our last baby we lost at 21 weeks, and he was born on January 26th of this year, 2018. My due date for baby Levi is January 23rd, so it is very close. It hasn't been a whole year since baby Lucas was born. So As it gets closer to his due date, and I knew that it would probably be this way, I was going to be very emotional. It's just very sensitive. So as it gets closer to the 1-year anniversary of him passing, as well as getting closer to meeting baby Levi, there's just so many emotions that it's like, I don't know, I'm doing my best dealing with them and not being an emotional wreck. Anyways, that kind of branched off back to, I guess, to deal with the emotions and the gallbladder issues, is I did have a little bit of a breakdown Monday because I had an attack, and it hurt so bad, and I am so tired of being in pain. Like, it's very exhausting, and I just cannot wait for him to be here so that I can have something done about it, because being pregnant, there's just nothing that we can do until he is born, and then we can go, I can have further testing done and possibly have it removed, which I believe is what's going to end up happening. So yeah, the gallbladder issues and the reflux, it's just been very taxing on me. I'm just like getting really worn down. I'm honestly at the point in this pregnancy where I cannot wait for him to be born, and I know he still needs to cook in there a little bit longer. Just getting very anxious. The last couple months are always the hardest. Your body starts to feel worn down. You get very uncomfortable, and you're just anxious to meet your little baby. So that is basically where I am right now. Another symptom I've been having is I have been very hungry this past week. I've been trying to snack on like trail mix, like nuts and stuff like that, just to kind of help me stay full longer without eating like large meals, because like I said, the whole gallbladder issue thing. I have been having some cramping. It's usually only at night though, so I don't know if it's just like stretching. I think most of it's like around ligament pain, but every now and then I do get some cramping and lower back pain. That's pretty uncomfortable. Like sometimes it wakes me up in the middle of the night, but then it goes away. So that has been kind of new. I've had cramping occasionally off and on, but it waking me up in the middle of the night is new. So I've been having that. Pretty much it as far as my symptoms go. Now, I did have my 35-week doctor's appointment on Tuesday. So the day before I turned 35 weeks, I had my 35-week appointment. And at that appointment, everything went well. I was weighed, which I already mentioned my weight. Pretty much your standard appointment, nothing special really happened. Well, actually, I have to start doing fetal monitoring for baby Levi, just as a safety precaution because of my history with the last pregnancy. My doctor just wants to keep a close eye on him each week from now on, because I am on weekly appointments now, just to keep a close eye on him and make sure that he's doing okay. Basically all it is I just have to sit in a room, and they put a heart rate monitor on me and monitor his heart rate for a certain amount of time. And he did pass on Tuesday, so that is good. Also, my doctor found out that he is now breech. He was head down, and I was feeling a lot of pelvic pressure. And now that he has flipped, and I can tell he's flipped because I do not have that pelvic pressure anymore. But yeah, he's flipped. He was head up. I'm really hoping that next week he will be in the right position. I do have an ultrasound at my 36-week appointment, which was already going to be done. But now I'm just like really hoping that when I go to this appointment that he will be head down. But because he is now breech, I do have to do an epidural consult at my next appointment in case I have to have a C-section, because if he doesn't flip, I have to have a C-section now. And the farther you get, the harder it is for them to flip, so my chances of a C-section are a little bit higher now, which I'm pretty bummed about. So I was really wanting to have an all-natural labor. I had a vaginal birth with Isaac. It was great. I did have an epidural with him. When I delivered Lucas, I did that completely natural with no pain meds. Of course, he was really tiny, but I still did it all natural. And then this time around, I wanted to do a natural birth again. But there was the situation with my placenta being low, which was possibility that I would have had to have a C-section, but then that corrected itself, so I thought we were good to go. But now he's head up, and the chances of me having a C-section are higher now. because as he does get bigger, he is running out of room to flip back into position. So I guess we'll find out at my next appointment what exactly will be going on. Because like I said, I do have an ultrasound to go to next week on Friday. So all of that will be in my 36-week update. I'm going to wait until after that appointment to do my update so that I can kind of go over everything that is done then and what they see on the ultrasound. Basically that ultrasound is just for growth and fluid measurement, and then also to see if he is head down, if he flips. I guess that is pretty much it for this pregnancy update. I feel like this was all over the place. Isaac has been distracting me, so I did the best that I could. But yeah, so I guess I will go ahead and show my 35-week belly. So here is week 35. Yeah, your tongue's red. And from the front. Alright, like I said, that's pretty much it for this pregnancy update. Oh, I did get my hospital backpack, so I'm actually going to probably film that next. And then I'll have that video up for you guys. And just everything that I'm going to pack in my hospital bag. And yeah, so be on the lookout for that. Make sure you're subscribed so you don't miss that video. And yeah, so thanks so much for watching, and I'll see you in my next update.